Yeah, so hello everyone. Thank you for joining our webinar today. Hope you all are keeping safe. In these unprecedented times, we know caring for your parents is tiresome and you're worried for your parents back at home. I am Alka Gupta, Tribeca, Marketing Manager of Tribeca Care. I will give a brief introduction and then I'll welcome our speakers on board for this webinar. This webinar is for 45 to 50 minutes and we already have 27-30 participants. People are still joining in. So you, as you know, you all are being muted on your entry. And if you want to speak, you can click on raise hand. We will unmute you for you to speak. If you want to ask a question to our speakers, you can type in the chat box. We will address all your questions towards the end of the webinar. So let's welcome our speakers, Mr. Tomojit Datta, CEO, co-founder Tribeca Care, Mr. Prateep Singh, co-founder Tribeca Care, Mrs. Elena Datta, co-founder and Chief Strategy Officer Tribeca Care, Mr. Jayanto Sen, Chief Operating Officer Tribeca Care. Now I will hand it over to Tomojit to start the webinar. Welcome, Tomojit.
Thanks, Alka. Good morning, good afternoon to you wherever you are. Quick introduction. My name is Tamojit, and I'm one of the co-founders of Tribeca Care. It is my absolute pleasure to welcome you to this webinar along with my colleagues Elena, Prateep, Jantada, and Alka. So this is, of course, an unprecedented time for all of us. And it is even harder for those who are at higher risk, for example, the elderly. Many of us are especially worried about our own elderly parents and how they will cope in this developing COVID-19 situation. We are increasingly being asked by worried families about how best to protect their elder loved ones in Kolkata, especially, but generally in India. And we've been asked lots of different kinds of questions. So I'll give you a couple of questions which have come from many sources. Number one, should the elderly maintain social distancing even after the lockdown ends, for example? Another question which is very popular is, how do we even start practicing social distancing in a country like India, where people are constantly coming in and out of your house? For example, cooks are coming in, maids coming in, drivers, etc., etc. So this webinar is our attempt to answer some of those questions. We may not have all the answers, but we will share, or at least try to share, our experiences about senior care that we have developed by serving over 20,000 members in the last 7 years. Some of you on this webinar are probably already Tribeca members. Some of you are just taking care of the elderly on your own. But whatever your situation, we hope that this webinar is somewhat informative and at least useful for your purposes. So thank you once again for taking the time off and joining us. First, a little bit about Tribeca itself. We are one of India's largest elder care platforms, having provided more than 6 million hours of care, home care, to people in Kolkata alone since 2014. Our mission is twofold. A, to help the elderly lead a better, safer life at home, and B, to help families manage their loved ones' care more easily, even if they themselves are not in the same household as the elderly. For each of us founders on this call, Tribeca is a deeply personal cause. So for me, for example, it was seeing my mother struggle with the care of my father, who became paralyzed after multiple cerebral strokes. Both her sons, my brother and I, lived in London and continue to do so today. And for her, it seemed like an unending cycle of organizing nurses, physios, oxygen cylinders, frequent hospitalizations, etc., etc. So caring for such a loved person like my dad became a 4-year war of attrition that drained and shattered us as a family. Now, unfortunately, that situation is increasingly common in Kolkata today, as all of us tend to go out of the city to find our own career and our own prospects. So we have busy lives, often far from home. But when one of our own parents fall ill or fall down, We are torn between rushing back or continuing life as normal. Now, Tribeca is our attempt to make that decision easier for you by providing a one-stop platform that helps you manage senior care remotely, but actively. So what started as a very small effort has now scaled up to about 150 employees and a huge network of healthcare providers. So for example, our first response team, which is our emergency call-out team, has done about 5,000 emergency hospitalizations since inception, since 2014. We work very closely with doctors, hospitals, and medical device companies on the ground. But that does not mean that we are perfect. We are far from it. We make mistakes. And as you know, India, especially Kolkata, is a tough market to operate in. Yet as a team, we try and learn quickly and we try to improve. But most importantly, we are trying to solve problems for real families. And there are real problems that require very often very customized solutions. Since 2014, our core mission has remained unchanged, which is to provide or bring peace of mind to families taking care of their elderly parents or relatives. But our services have evolved over time, along with our understanding of what families truly need. And this could not have been more true than in the COVID-19 situation that we are currently in. So let me run through a couple of typical problems or typical member problems that we see. The first one is what I call the high dependency request. So the high dependency request is, my father is, say, 85 years old, he had a stroke and will be released from hospital fairly soon. He needs nursing support, 24/7 nursing support, intensive rehabilitation. He may also need ambulances and a doctor in times of emergencies. I also need a good care manager who will coordinate major decisions for the family with my sister in Bangalore and me in London. So that's a typical high dependency request. But we also see lower dependency requests. So for example, my mother is 73 years old. She's practically fine, but she needs a 24/7 maid to help her every day. And we also need a care manager to do runaround things like a bank work, or for example, pick up the grocery, for example. So as you can see, ours is a high involvement service where employees, my employees, are actually at someone's home taking care of typically fairly vulnerable people. But now in a COVID-19 situation, how do we manage care at home sensibly that minimizes risk both for our members and our staff? It's not an easy decision, it's not an easy solution. So in this lockdown period, like much of the global industry, we are evolving our offering too. So be it our doctors, our care managers, our physiotherapists, our psychologists, nurses, our senior travel advisors, we're still caring, but with many more precautions. So a host of measures have been implemented and more is on its way. So more PPE kits, less physical contact, more phone calls, new online services. But the ultimate goal is to reduce the need for seniors to step out of the house and to expose themselves unnecessarily. And in fact, we think that some of these changes are good because they will probably remain in place even after the lockdown, because we don't know how the virus is going to evolve and develop over the next few months. With that, I hand over to my colleague, friend, and co-founder, Alina. She will talk about some of the popular Tribeca services that we are seeing being demanded by families during the COVID-19 crisis. And then my other co-founder, Prateep, will come right at the end, and he will talk about more what we individually can do to help our own family members, irrespective of whether you are using Tribeca services or not. So with that, I hand over to Alina.
Hello, everyone, and thank you very much for joining us here today. I do know that many of you have questions, which we will answer at the end of the session. But here's what I thought when we first decided that we would do this webinar. And when the question came up whether we should or not, my first thought was, why will people want to listen to us, right? What is it that we are going to say to them? And then I thought a little more, and here's what it turns out to be. Just like you all are far away from home now and worried about your parents, Pradeep, Tamarjeet, and I have been in exactly the same situation. We've been living far away from our parents. And whilst Tamarjeet has his own story, mine is really about not being in the country. And I lost both my parents within 4 months of each other. And it was the most devastating time for me because they were very young. And nobody dies at 60 anymore, you see. I decided over time, and it didn't happen in a hurry, I decided over time that if I looked after other people's parents, I would feel better. And that's exactly why I started this. And I make sure in every which way I can, from the staff coming in to the care managers that we train, to all three of us, Tamarjeet, Pradeep, and I, who work at this diligently every day, among other things that we do, is that this thinking is embedded in our DNA. So what I would do for my mother, I will do for yours. What I would do for my father, I will do for yours. And I think that kind of caring through with our care managers, because a lot of them go back to families even when the members are lost because the children keep in touch with them. I don't know that you will want us, any of us, to talk about what the problems on ground are with the new normal. Pretty much everybody knows, and Pradeep will take you through with what we are doing to tackle this. But what I will talk to you about are I'll give you a quick snapshot of the things that we are doing to help the elderly parents while we are under lockdown here. In the beginning, while everyone was still sort of trying to deal with the upheaval of it, I personally got several calls asking for different kinds of help. Some saying that they needed help with food, some with staff, some with medical emergencies, falling down at night, breaking ribs, and so on and so forth. So within a couple of days, we started getting our things together, and we started, in addition to the first response team that we already have, which is up and active over the last 5 years that we've been around. And we've done, as Tamarjeet was saying, about 5,000 emergency hospitalizations. But now, actually, in the last couple of weeks, we've done several more under the most difficult circumstances. And Joyant Sen, when he takes up the Q&A later, will be able to give you numbers on this. In addition to the first response, what we have is what we call the Dare to Care service, where our care managers, fully masked with gloves, sanitizers, in a car which is sanitized every hour, goes across town buying groceries, medicines, delivering devices, taking parents to hospitals, getting ECGs and X-rays done. Not only just these things, but also going to the bank, picking up money, delivering cash, helping manpower reach, making sure that nurses who are there on duty are, continue doing it without too much turbulence, all of those things. We've also parallelly started a assisted telesurgery line where we've listed out several doctors that we have tied up with, who you can call, some of them at specific times because they're working in the COVID hospital or they are working in their own clinics and so on and so forth, but certainly more than a handful of them, where anyone can call and speak. So for instance, if you have a maid at home who's been with you and has been coming and going, and you've had a part-timer suddenly starts coughing and sneezing and has fever, you need to talk to a doctor and figure out what needs to be done and to evaluate it on ground. So telemedicine helps with not just self things, not about having fallen down or having an issue with blood pressure, but also to answer questions that are related to COVID. That is one. Yeah, we have, of course, and you will perhaps know, the award-winning Family Matters programs that we run over the last several years. Those are actually a lot more robust now because the care managers are making calls pretty much every day rather than once a week or twice a week as was prescribed earlier or as was chosen earlier. But right now, because we know that people are feeling disjointed, they're feeling, abandoned, for lack of a better word, that nobody feels left alone and nobody feels lonely. So we have ramped up our services around the care manager protocol that we already have. We have 24/7 geriatric care support house staff because we are not recommending that anybody have staff coming in and going. And though lockdown has been lifted across a couple of places and some of it is still in red zone, some are containment, and so of course that particular area is completely out of bounds. But we are helping people get 24/7 live-in maids so that contamination is less, contact is less. These are people who can help pick up groceries and so on and so forth as well. So there is that. Apart from this, the impact that this kind of situation has had on the elderly, some of whom may be living alone because they're widowed and so on and so forth, is certainly on mental health. So we have a helpline that we've tied up with psychologists whereby they can call in and speak. But more importantly, for everyday calling, we've pulled together a group of volunteers spanning from class 9 children all the way up to people who are in their 50s, making daily phone calls to a list of people. So even if you're not a Tribeca member, if you have parents or aunts and uncles living by themselves in Calcutta and you would like us to call them and ask how they are and sort out any issues before they get to be large, don't hesitate to tell us, and we will certainly make that possible. Before I hand this over to Pradeep, I wanted to, of course, say thank you to all of you for being here on this webinar with us, but also to tell you that at all times, given the circumstances such as it is globally, it is not about whether you are Tribeca members that you can reach out to us for. Call us or talk to us if you need help on ground, if you need information, if you need to be connected. We have an extremely large network of healthcare providers and so on and so forth. Call us. We are here for information, for any kind of help that you may need. Thank you, and Pradeep will take you through the rest of it.
So very good. Thank you, Alina. So my name is Pradeep Sen, and as everyone said, I'm one of the co-founders, have been doing it for about 6 years now. What I'm going to try to do is to sort of distill what we spoke about so far. I'm not really going to talk about Tribeca and what we do within Tribeca, but what I'm going to do is to tell you what we think is the world going to be looking like, once the lockdown is over, and therefore, how should you be thinking about caring for one of your loved ones back home here in Kolkata, right? So let's just start with what the assumptions are, right? So our assumptions that we know, and I'll very quickly go through this, is we know that this is not going to go away, right? And you read all the newspapers, everything, we know that it's probably going to be a 12 to 18 months to 24 months that we are going to be in this situation. And we have to live through this. We also know that elders are more vulnerable, which means to say, you look at the mortality rates, it is about 15% so 1 in 7 of the elders over 80 don't make it. And for anyone over 65 or 60 or 65, the number is about 1 in 15. So not very good news for anyone who's older. The third thing we do know, and people are talking about, is that governments have actually said across the world, saying that if you're over 60 or if you are under 10, stay at home, right? So that's been a general tenet, that's been a general discussion that everyone has been having. So we understand that. On the other side, our 6 years of experience within Tribeca out here, there are a few other things that we know, right? We know that elders need help. They're vulnerable, they need help, right? So if there is someone who's 80 plus, they probably have a live-in maid and all of that. The need of help, the help that they need is very, very high touch. Someone who's about 65, 70, it's going to be lower, but they still do need some help, right? So that's one of the things that we know about the elder population. The second, we know that the more that they stay at home, the more they will be depressed, right? So, and it's a vicious circle that happens, that when they stay at home, they get, their level of confidence goes down. Once their level of confidence goes down, their physical health goes down, they don't exercise as much, and that's the vicious cycle. And lastly, there's a few psychosis that happens, which again plays havoc in the minds of elders. So knowing this, what is it that we have to do for our elders, right? And I think the crux is this. The crux is that there has to be what we call an envelope of care that we create around the elders. It's going to mean that they are going to be in a slightly more protected space for the next maybe about 12 months, 18 months, but that is going to be very critical. So this This one also means that you reduce the contact as much as possible with outsiders, and you make sure that the people they are in contact with, because they have to be with people, is as managed as possible, right? So sanitization, all of that. So low touch, no touch is going to be the mantra for the envelope of care. How do you actually put that in practice, right? And to put that in practice, we think is 6 steps. And we sort of spoke about it, Alina spoke about it, Tamarjit spoke about it, but these are the 6 things that we are saying. One is move maids that you have to live in maids, right? So move away from a person, coming in and going every day, but move it to a 24-hour person who's in the premises and living with the elders. That's number one. The next is that if that happens, how do you get your groceries? How do you get your essentials? How do you get your medicines? That is where you need to get outside help, and maybe you already have a structure in place, but make sure that, so it's just not about the big baskets and the grofers, but it is also to make sure that there is someone checking in, making sure that the groceries and all of these things are being provided for at the doorstep, right? So again, low touch method to actually reach it to the maids who will then do, take it to the kitchen and work through it. Doctor visits, right? And going back to this one, it's very critical, because what you don't want, and we have a lot of elders who don't like people coming in, and that's right, because it's almost like ushering in death into the house, right? And no one wants too many people to come in. So number 3 is doctor visits. Doctor visits, and this is actually, if you really think about it, it's probably a silver lining with all of this, is that doctors never like to visit people at home. So it was always a challenge to get people at home. But through this process, what's going to happen is that teleconsultation is going to be a lot more prevalent. So we have already done, over 100 teleconsultations with our members over the last few weeks. That's going to increase, but wherever you have an 80-year-old who can't do teleconsultation, we can do an assisted teleconsultation in which one of our care managers can manage it. But it could also be someone that who can actually hold up the phone or something and do the consultation. So depend a lot more on teleconsultation. That's number 3. Number 4 is you have to prepare for emergencies, right? And in the US, if you have a kid, they almost tell you to pack your bags and know exactly where you're going, to which hospital and so on. The same process you have to use out here, in which which hospital you're going to go to, you're going to take your mother to. You have to prepare in advance. To a large extent, you should know sort of the ins and outs, because right now there's a lot of fluidity that's happening in this sector. Some hospitals are COVID, some hospitals aren't, and therefore you need to have a structure in place. You need to have people in place who can actually navigate through that process. So it's not just knowing which hospital, but being in touch with the right ambulances who can actually take them there and then get them admitted, right? So you need to have people you trust to do that. One thing you have to remember is that even normal people are not willing to go into hospitals as much today. So think through this process of how do you prepare for the emergencies. 5 is monitoring, right? And monitoring is important, because the more you are in control, the better it is. So understand what's happening. Just don't speak to your mother, because your mother will say "Shab bhalo aaje," right? And you don't get a full view of it, right? You have to get third-person views, maybe a neighbor, maybe the maid, but through that process, try to gather that information so that you can really understand what's going on. So monitoring is important, and again, what we do is through a mixture of visits as well as things. But you could create your own way to actually do that. Last is mental health, very, very important. So as I say, speak to your parents all the time, but at the same time, what you have to do is figure out what is sort of making them depressed, right? Does it mean to say that you need to get some more Swiggy deliveries to them, and things like that? I think is going to be critical, because we will come out of the lockdown in about another month. They will be under lockdown for a long period of time. Question then is, what is it that we have to be, what is it that you have to be thinking about at this point? And I think it's a few things, right? And again, I'll hurry through this. So you know what to do. The question is, what's your mindset going to be? One is create processes, get people who talk to them in advance to actually do this all for you, right? So in each of those 6 things, almost use a checklist to figure out what are you covering and what you aren't, and where do you need help. 2 is, as I said, get control, right? Get control of the situation. You don't want it to sort of like open up and become a big mess, right? So understand what's going on, talk to people, and I keep saying that control is going to be important for everyone. Do that. And if you have friends in the industry, within doctors and all that, use that, but try to understand a lot more of what's going on in your parents' home. With that, what we have done on that side, and I won't get into it, it's a good escalation matrix and all that you create, but make sure that you're hearing whether you use us, use someone else. Make sure that issues can come up to the fore very, very easily that you can then take action on. The next thing is about keeping your ears to the ground, right? Things are very, very fluid, which means, again, as I say, there are certain areas which are contained areas, some parts which are, red zones. All of those things means that in certain places, maybe there's a person who's coming, but now they can't come in anymore. And therefore, you need to understand the lay of the land. I know it is going to be difficult if you're in a different city, but that is something that's going to be very, very important. In fact, John Tuda, who's on the call, he almost has a daily touch with the police and with the bureaucrats to understand what's happening. And through that process, we can actually make sure that care can reach even the furthest corners of the containment. Before and the last thing that you have to think about are all the extraneous things, right? So does your home need, do you need a carpenter? Does your home need cleaning? Does your mother need, are the taps working, right? How do you manage all of that? Staying outside when you don't want too many outsiders to come in. That is, again, a structure you need to create. But again, think through that process, right? How do you do home maintenance and all of these good things in the next, for the next year and a half? But that's, again, something for you to sort of consider. With all of this, I think I've sort of spoken more of, what I had to. I want to leave you with a couple of things, right? One is that the intention of this, these are, as we said, very, very trying times. And the intention was to give you a flavor of the situation here in Kolkata and with the elders, right? So we've seen all sides of it to give you that flavor. Now, I've been in London and New York for many, many years, so I understand how a lot of you probably feel. When you're a carer and far away, right? A lot of your own situation sort of seems so difficult, and sometimes it feels very insurmountable, right? After 6 years, running Tribeca, I know one thing, right? Everyone's own situation looks impossible and daunting, but talking about it helps. We always think that our own situation is very peculiar, but there's usually a precedent, right? And using that, we can make suggestions that can make your lives a lot better. Lastly, right, the predictions all seem very doom and gloom, right? And why is that, right? I think it's a fundamental philosophy that we have as an organization, that we hope for the best, but we prepare for the worst, right? Again, it is good to be optimistic, but yet we have to stay grounded. And the reason why we have to do that, it's the lives of people that we love that's at stake, right? And being cautious at this time is going to be very, very critical, right? So right now, if there are additional questions, any thoughts that you have, please ask us anything that you want to. I'm going to now hand it over to Alka, who will then be able to, I think you'll have to raise hands and then ask the questions, and then, we will try our best to answer as well as we can. Alka, over to you.
Thank you, Prateep. I'm sure this session will help us a lot in some way and form. So we have many questions coming up. There's one question from Shravani Roy rather. So I will unmute you, ma'am. You can go ahead and ask your questions to our speakers.
Hello, this is Shravani. Thank you very much for holding this webinar. I think several people have asked this question in the chat. My main question, my mother lives in Kolkata alone. Well, she has some help at home, but both my sister and I live abroad. I'm here in Cambodia. My sister lives in the US. And we are Tribeca members. So what we would like to know is really two questions. One is, what kind of support is Tribeca able to give in case of emergency during this lockdown period? I'm hearing stories like many hospitals in Kolkata are closing. Doctors aren't even coming to hospitals because they're afraid of the COVID virus. So what kind of emergency help can
Yeah,
can
Shravani.
that
Thanks
too?
for your question. I'll pass this question to our Chief Operating Officer, Mr. Jayanto Sen.
Good afternoon, madam. Let me tell you that we have put emergency protocol in place in the normal time, 24/7.
I
Emergency
think
helplines there.
there's a problem with your network.
Janta, you speak again.
Yeah,
Hello. Hello.
yeah.
Now is it clear?
Don't come too close. Don't come too close. Just stay a little further away.
Hello.
Yes.
Yes, we can hear you.
Madam, actually, there is a emergency protocol in place for 24/7.
You are not audible, Jayantada. We cannot hear you. There's a lot of noise.
Let me answer.
Maybe we'll get Tamajit? Hello.
I think Tomojit can answer this question.
Sorry about the technical problem there. Yeah, I think aspects to that emergency question. One is which hospitals are open, which doctors are working, and the other is what can Tribeca do to take the member to the right place. I think you're absolutely right about the hospital situation. I think there are a number of hospitals which are closed, and there are certain hospitals open, but there are only some beds available. Unfortunately, can't come on the call, but he has. On the other side, what is our response organization to an emergency kind of situation? We've already done that in the lockdown. I think Jyotika probably would have told you we've done about 100 hospitalizations in the last zone. So we are fully operational to the extent possible with our ambulances, etc., etc. There are a few red zones where I think there is some difficulty in getting to, but on the whole, I think the first response emergency response team has been working.
Hey, Tamajit, even you are breaking up badly. So maybe I'll try to take a stab at it. Hello.
Yes, Pradeep, go ahead.
Yeah. So let me try to do that. Tamajit, you are also breaking up, right? So I think the entire emergency response method is working still very well with us. There are 2 or 3 aspects of it that I'd like to cover, right? One is to make sure that if there is a call that comes in, are we able to reach an ambulance out there? And are my care managers able to reach them and then take them to the hospital? So far, we've been absolutely 100%. We've been able to do that, right? So with the ambulances, we know that there are ambulances which are gouging and all of those things, but we have our tie-ups, we have our understanding. Even at 2 o'clock at night, we have had people, our care managers going in, picking up someone, getting the ambulance, picking them up and taking them to a hospital. And if things are fine, bringing them back in about 4 or 5 hours, right? So we have done it on this side of it and, 100%. On the other side, on the hospital side, we know of the hospitals which have problems. In any case, a lot of you have actually told us that it is option A or option B. So you take them to Medica, or then if not Medica, to let's say Ruby or whatever it is that you have decided. So we have a very good idea of it because we can call in advance, and through that process, being able to actually take them out there. So through this process, I think our entire emergency system is working well. In certain zones, like in the containment area, and Jantada knows that very well, it's even difficult to get an ambulance in, but that is when we have to talk to the police, and that's when the police can actually help us navigate, through that little bit of whatever is out there, and then take the person into the hospital. But we've been doing that pretty well right now. Does that answer your question? Hello?
Yeah, I'm sure it does. Thank you, Shravani, for asking this question. We have another one from Mrs. Purba. So, ma'am, can you please ask your question?
Okay, see, like Shravani, we have the same issue. Both the sisters, we live abroad. I live in London. My sister lives in US, and our parents are very old. My dad is 86, and my mom is 81, and they have got a lot of health issues. My dad can barely walk. Well, we have got very good care providers from Tribeca. We have absolutely no complaint with the care managers. It's just our concern is if touch
अपना
if
phone
there is
disconnect कर दो.
emergency,
Internet. Wi-Fi
how
बहुत load
can
हो रहा है.
Tribeca take care of them?
This time, nowadays also, during the COVID period, except certain locations where we have got no access. Periodically, Kolkata police is announcing certain areas where they are saying the people to stay indoor and any services required will be provided by the Kolkata police. So most of the areas in Kolkata, we can go and we can do our job as and when required. So for emergency, we have got tie-up with the ambulance providers. Our care managers are always alert. We have got an emergency helpline. In case care manager is not accepting the calls, in that case also the calls are landing on the emergency numbers, and at least one of the 5 will pick up the call and do the needful to the care manager and through the ambulance provider. So please don't worry about that.
Okay, that assures, that gives a lot of assurance. Hopefully,
Yeah,
service will be provided. That's the only
definitely.
concern we have.
We have made at least 30 to 35 hospitalization during this COVID period.
Okay, because what I have heard, my parents, they live in Salt Lake. What I have heard from my friends, there's been loads of cases within Salt Lake. And I
Right.
think what the police have done, they have closed most of the areas.
Yeah.
It's really hard for them. Like at the moment, they have got all the vendors like vegetable and all the fish vendors, they are coming up. But what if that stops? How will they deal with it?
Nothing to worry about that. Salt Lake Police has done some excellent arrangements that they have given some phone numbers for getting vegetables, for getting fish, for getting medicines, everything they are doing. Okay. And in addition to that, in some cases, our care managers are allowed by the Salt Lake Police. We have got certain connections over there, and they are allowed inside so that they can provide the service and come back immediately.
Okay, I have got one problem as well. Like, as I said, my dad, he had cancer like 2-3 years back, and it was operated. He's touched wood absolutely fine now, but he uses a bag which is called a colostomy bag, which at the moment, both myself and my sister, we have been trying our best so that he can get the supply of the bags. But at the moment, I think my mom is facing tremendous difficulty getting them at home. So what sort of assurance do I get from Tribeca? I mean, we have tried ourselves getting in touch with all the big pharmacies and stuff, if it can help her to get them delivered at home, but without luck. So I'm not sure what will happen.
You don't worry. I will ask the concerned care manager to get in touch with your mother and do the needful. Okay.
Thank you very much.
Don't worry.
Thank you.
Please give a call to our care manager and he will do the needful.
Yeah, and on this one, I think we have very strong connects within companies like Toloplast and the other one which does the stoma bags. So I'm sure we'll be able to figure out how to get the stoma bag. We have very good connections.
Okay, I think we got, well, I work mostly I work with them at the moment because my sister is quite busy. So I have been in touch with them. I think they tried. It's just the size which my dad uses. It's very difficult getting, and I'm really worried. Once it runs out, what will they do?
Understand. I think we will sort that one out. I'm fairly certain that we could. I think the fundamentals, what's coming out of this discussion is that there will be very, very unique cases in different homes, right? And I think as a company, we are fairly well placed to figure out how to solve these, right? What needs to come out is percolate it up so that then we can look at it and then say, how do we solve for it, right? I don't think problems are, again, insurmountable during the COVID period. We just have to find ways to get it done or speak to people senior enough who can help us. Sorry, Alka, do you want to go to the next one?
Yeah, we are towards the end of the webinar. We can take one or two more questions. Mr. Suman Raha, he wants to ask some question about emergency services. So please go ahead and ask your question.
You need to get on off mute. There is a button on, yeah, that's right.
Yes, I got it.
Yeah.
Hi, good morning, all of you. Pradeep, Tamojit, and the team there, thank you very much. We have been a member of almost 3 years now, and particularly my in-laws, my wife is here, they're in Koshba, and we have a care manager, which is Gaurav. He's just fantastic. I'm saying, first I want to really thank you guys for providing these services, and we have been extremely helpful, got a really tremendous help in the last 3 years. But my question is still on that critical situation, and this is where we are really getting concerned that if there is an urgent care need, emergency situation, other than COVID, I'm saying forget about the COVID situation, what would be the reactions or what help can we get? I think that is because what we are hearing about, most of the hospitals are not taking non-COVID patients at this moment. And I'm sure you have probably lined up hospitals. We do have friends, but what we hear is the biggest concern actually, that the people are dying actually because they're not allowed to have any kind of services or even admissions or emergency care. I think that's, if you can address that, at least give us some level of comfort that you have a line of actions to handle those situations, please.
Yeah,
Yeah.
Jayanta, please answer the
Yeah.
question.
As I told you already earlier, I was answering to the question of another member that we have already made at least 30 hospitalization during this COVID period. It is true that we have faced some problem in admitting the patient to a particular hospitals where they're supposed to go. But with our connections in so many hospitals in Kolkata, we could manage them to admit. Not a single patient was refused so far. I agree that it is very difficult. Sometimes part of the hospital is declared as a COVID hospitals. And at that time, they refuse to take the normal patients. But then, if necessary, if one hospital refuses, we can manage to admit in some other hospital. So far, we have not faced some real problems. And hopefully with our connections and other things, we'll be able to manage this critical admissions and other matters. So
Thank
don't
you.
worry.
Yeah, I have another question. That is, if my dad is like 87 plus,
Yeah.
sometimes it may be a situation where a few injections, intravenous injections and saline he may need, for which, do you have any facility that can be organized at home? I have got very good doctor friends all across Calcutta.
Yeah.
But even they say sometimes, but with this age group, saline for 2 days, few injections intravenous, that can help instead of bringing them to the hospital. So just want to know whether you have any such setup which we can take help of.
Well, in some areas, it is very difficult to get trained nurse who can go there and do these things. Because for this, we don't need a doctor. Okay.
Yes,
So we need a
exactly.
trained nurse. We have got trained nurse in our payroll. But the thing is that if sometimes we can manage, but in some cases, if the nurses are not available at that particular location, then we have to take him to a nursing home.
Okay.
So let me answer that in a different way, right? I think so. In Calcutta, we have one of the largest network of hospital brothers and trained nursing, all of that, right?
Mhm.
However, when there is something like a catheter change or something which is a little more elaborate than what a nurse does at home, it
Mhm.
has to be under the guidance of a doctor, right? So what we try to do in every case is not to be the doctor, right? So it would be a doctor that's there who is then guiding the person, maybe gets onto WhatsApp if he can't do that, do a video thing, speaks to the person, and then sort of helps through that process. We never try to do it ourselves. There has to be a doctor that you
Involved in
guys
it.
trust, who then does it. We provide all the support services to you and the doctor. That is the way to think about our services.
But if the doctor says, like say Dr. Roger Sharkar of PLS, he's a very good friend of mine. I've got a few in Medica as well. Like if he says that, do you really need to bring him for this, Jaita? Would you be able to arrange somebody if I guide them?
So again, we have good connects within all the hospitals and a lot of the doctors. What I will then do is to get one of my persons to actually talk to the doctor, figure out what is required. We will go back and see who do we have, right? Make sure that the fit is right. So we won't do anything which is an emergency. We'll take a time, make sure it is right. And then with the doctor's blessing, we will do that, right? So the doctor will then say, yes, let this hospital brother go because he has the right level of service, and then we will do that. So we are not going to get some nurse to do that who we don't really understand.
I totally understand.
Yeah.
Thank you.
Thank you
Thank
very
you,
much.
Pradeep. Thank you.
Thank you, Alka.
Thank you very much for your valuable service. It's really a big help to all of us. And I've been working with you for last 4 years, maybe
3 years.
3-4 years. And I'm really happy with your care managers.
Thank you.
Thank you. Thank you.
He sends me text messages on and off. Didi, is everything all right? Shop ঠিক আছে নাকি মাকে phone করবো? I say, no, I am fine. You concentrate on other patients. If I need you, I will give you a call. Thank you very much, Tamojit.
Thank you.
And do we have time for any more questions? Or is there any pressing question that people have? So Alka, you may want to close.
Could I ask one more question? Sorry, this is Strabani.
Yeah.
Sorry, we have one of your Tribeca Ayas staying at my mom's house. She comes in the evenings usually. Once the lockdown is over, we're still not sure exactly when and how exactly it's going to get phased. What kinds of precautions are the Ayas taking? I mean, obviously they're going to start taking public transport and things like that. I mean, that's a bit of a worry once lockdown happens. Like, would you recommend, even once a lockdown is lifted, to keep somebody's like the Aya 24 hours even after lockdown is over? And what kind of training are you giving them in terms of hygiene and things like that also, just so we also understand?
So do we have Tamojit on the line?
Tamojit.
I'm sorry, my internet connection is very unstable and the call is keep on dropping. So
That's fine.
I think
yeah, so Tamojit is the one who actually manages that side a little more, so he would have been the right person to answer. I will tell you what we understand it as, right? So we know, so our fundamental premise for the next 1.5 years is have low touch, right? So have the person stay at home as much as possible. In a lot of cases, you'll not be able to do that, and you will have to have a new person come in. In those situations, again, what you do is try to make that as few as possible, right? So again, if one person has to be replaced with another, and we understand that after the lockdown, there would be a lot of the maids who would want to go back home. They've been stuck out here for a good month and a half. At that time, we'll have to bring a person in. We will do that the way that we've been always doing it. When it comes to what type of a person are we bringing in and how do we know whether he or she has COVID, right? There are no tests really happening in the city, so no one really knows. But what we will make sure happens is that we will do all the right checks in the very beginning, which is, fever, cough, all of those things that you would do with anyone else. Use that as a methodology to decide whether this person, can get into that home. Along with that, what we will do is, train her along with the gloves and, washing of hands and the masks and all of that. So we will provide all of those sanitization protocols and so on for every person coming in. The whole fundamental idea is we understand that you can't eliminate it, but you reduce it as much as possible.
Okay, thank you. That's helpful.
You're welcome. So I think, I don't know if Alka can hear this. So I think we are done for today, but I really wanted to thank you. Alka, do you want to say some certain things? If you're...
Yeah, no, actually my internet connection is so unstable. I'm so sorry. So I think this is the end of it. We have to wrap up our webinar. I hope everyone is satisfied with the session. And if you have any more further questions, you can always email to us, call us. We are always available. Keep in touch and keep safe.
Thank you, everyone.